Residency training really does shape, I think, the next steps we take in our career. And for me, I think one of the things it did was just show me the issues in public practice of psychology. And so the importance of providing good quality care, but also balancing that with an assessment of costs of that care, so being more efficient.
The legacy for clinical health psychology, I think, is training the next generation of psychologists coming up. And I think because of the vast amount of different experiences that residents can get, they're really prepared to go into a career wherever they might practice. I practice primarily in a community psychology setting, so a little bit different than a hospital setting, but I think the skills that I learned in terms of working with people, understanding people where they're at, development of leadership skills, I think was all a really important part. And the residents, knowing residents who have come out of the program working in Manitoba, they're strong psychologists and strong leaders.
Well, what really is unique and stood out to me was just the community of clinicians and the degree to which the department as a whole is engaged in the broader psychology community in Canada. That's something that continues to stand out to me. I still reach out to individuals in the department for guidance and advice, and the generosity with which they share is something that I'll forever be grateful for.
Favorite memory of my time in the program? Dr. Teschuk and us residents were flown up to Flin Flon to experience psychology in northern Manitoba. And we each did a presentation on a clinical approach. I remember covering ACT, and it was at this sort of mental health center. And it was just a hoot. It was so much fun for us. And in hindsight, also just a really invaluable experience, exposure to rural psychology in a really unique geographical area there.
The program really doesn't try to shoehorn you into any particular niche, which I loved, because for me, I wasn't 100% sure about what I wanted to do coming out of residency. So having that really well-rounded training, I think it gave me the flexibility that I wanted. And then one of the big draws to the program was honestly during the interview process. I got to meet the supervisors that I'd be working with, and I just felt the warmth radiating off of them. It very much gave me those friendly Manitoba vibes. It felt like coming home, and I just felt really confident that I would have a positive experience in the program with them.
The ability for me to talk to my supervisors about different opinions and have a discussion, and being given the autonomy to stick to my guns and sometimes fail, sometimes succeed, and learn from my experience. I think that was very useful for me, is that I make a decision, informed decision based on discussion. I keep having the freedom to do so, and not having the freedom to see the outcome of my decision and learn from that. I think that's a really valuable experience. And the confidence that I'm allowed to disagree with my supervisor and still be okay.
What was unique and stood out for me on residency was the warmth and acceptance of the faculty, who seemed to take a genuine interest in me and my development. Their own clear expertise inspired me to approach all of my clinical work with diligence and determination, as I saw them doing. It also gave me the courage to try new things, to speak up for my patients in multidisciplinary meetings, to advocate for the role and value of psychology in the medical setting, and to dream about how I might make a positive impact on the world with my own work.
I definitely think that because a lot of us residents went to the same building, we had a lot of really cool experiences, whether it was skating at the Forks or going out for dinner or just kind of exploring Winnipeg together. It was really fun, and definitely was a lot easier to make friends than I thought coming from away.
Moments and favorite memories was an opportunity that we had to go to the Thunderbird House and complete a sweat lodge teaching at a sweat lodge. I'm an Indigenous person, but myself didn't have opportunities to participate in a lot of that thing. So that was a big moment, I think, to be able to participate and learn in that way. And I know my fellow residents really appreciated learning. And for me, it was very meaningful. It was an amazing opportunity. And I feel that opportunity brought the resident cohort really close, because experiencing something like that changes, right? Your perspective of healing.
we have top-notch residents. Like, I have a lot of confidence in our residents. When they go in to see a patient, feel very good about that. And I'm very proud about that. And I think that's partly their preparation and it's partly our residency.